All right, today we're going to talk about something that's a real game changer for people dealing with the intense back pain that comes from spinal fractures. It's a modern, minimally invasive procedure called kyphoplasty, and honestly, it's completely changing the conversation around how we recover from these kinds of injuries.
Have you ever had this happen? You bend over to pick something up, maybe you just sneeze, or maybe you can't even remember what you did, and bam! All of a sudden you're hit with this sharp, awful pain in your back that just refuses to go away. It's the kind of pain that can literally stop you in your tracks.
And if that sounds familiar, you know it's so much more than just the pain itself. It's that constant fear of making the wrong move. It's losing that feeling of independence. Suddenly, things you never thought twice about, like getting dressed in the morning or just getting a good night's sleep, they become huge hurdles. This really affects your whole life.
So, what is actually happening in your body? Well, what we're talking about is a vertebral compression fracture, or VCF for short, and it's pretty much what it sounds like. One of the little bones that make up your spine, a vertebra, has cracked or collapsed. A lot of the time, this is because of osteoporosis, which can make bones weak and brittle, so even a small amount of force can cause a fracture.
You know, for years and years, the standard advice was, well, kind of frustrating. Doctors would often tell patients to just rest, maybe wear a brace, take some pain pills, and just wait. Wait for it to heal on its own. And the big problem with just waiting it out is everything that happens while you're waiting. We're talking weeks, sometimes months, of not being able to move around. And that leads to losing muscle, which actually makes you weaker and increases your risk of falling again. It's a really slow, frustrating path that can feel like you're stuck between a rock and a hard place.
But here's where the story gets better. What if you didn't have to choose between enduring the pain and enduring a long, difficult recovery? What if there was a door number 3, a modern, proactive approach that tackles the problem head-on?
And that solution is kyphoplasty. So, what is it? It's a minimally invasive procedure, meaning no big surgery. It's designed specifically to stabilize that broken vertebra using a tiny amount of medical-grade bone cement, and the goal is to give you fast pain relief.
Okay, I know. Any procedure involving the spine can sound pretty intense. But the way kyphoplasty works is actually incredibly smart and a lot more straightforward than you might be picturing. Let's walk through it.
So first, using live x-rays so they can see exactly where they're going, an interventional radiologist guides a very small needle right into the fractured bone. Then comes the really clever part. A tiny balloon is passed through the needle and gently inflated. This creates a small cavity inside the bone and can even help push it back up to its original height. Finally, the balloon is taken out, and that new space is filled with the bone cement, which hardens up in just a few minutes.
And really, the absolute best way to think about it is this. It's like creating an internal cast. You know how a cast on a broken arm holds the bone still so it can heal without pain? Well, this does the exact same thing for your spine, just from the inside. It stabilizes everything. It's a brilliant idea.
So let's just recap the big wins here. The procedure is minimally invasive, so you're not looking at a big incision or a bunch of stitches. The whole thing usually takes only about an hour, and maybe best of all, you typically get to go home the very same day. That's a huge difference compared to major surgery.
Okay, so this all sounds pretty promising, right? The big question then becomes, who is this really for? Are you or is someone you know a good candidate for kyphoplasty?
Well, generally, it's a great option for people who have a recent fracture that's causing a lot of pain, especially when that pain just isn't getting better with rest, bracing, or medication. It's very effective for those osteoporosis-related fractures, and it's a fantastic choice for people who just can't handle being stuck in bed for weeks on end.
Now get ready for this, because this is the part that is just astounding for so many patients. The results are often incredibly fast. We're talking about significant, sometimes dramatic pain relief within just 24 to 48 hours after the procedure. That's 1 to 2 days.
So after it's done, you're on the fast track to getting your life back. Like we said, you go home that same day, and most people can get back to their light, normal activities really quickly. Now, it is important to remember, kyphoplasty fixes the broken bone, but you still need to work with your doctor to treat the underlying osteoporosis to help prevent future fractures. So let me leave you with this thought. After weeks or maybe even months of being terrified to move, of guarding every step you take, what would it feel like to just stand up, to walk across the room, to live your day without that constant fear of pain? Because that's really what this is all about. At IR Centers, our team of interventional radiologists specializes in these kinds of advanced, minimally invasive treatments. Of course, every single person's situation is unique, so the best way to find out if kyphoplasty is the right choice for you
is to come in for a consultation.